There's a rumor, or maybe a myth is a better way to put it, that Canada is very far behind in terms of the adoption of advanced technologies. Well, AI is about as advanced as it gets, and it is everywhere. And the good news is that there are organizations in Canada that are really spearheading the effort to make sure that we don't fall behind as Canadians. One of those organizations is OntarioMD. And last year at this event, I had the chance to sit down with Rob Fox, the CEO, to ask him what they were doing about AI. And he was just about to start some really exciting initiatives. So here at this conference in Vancouver, I'm going to ask him how those initiatives have been doing and what progress has been made on AI. Hello and welcome to Healthcare IT Today, where we bring you the latest insights and interesting stories from the world of health IT. I'm Colin Hung, and you're about to listen to my conversation with Rob Fox, CEO of OntarioMD. Let's get to it. Rob, welcome back to the program.
Thank you, Colin. It's great to be here.
I'm excited because a year ago, you and I had a conversation about AI.
We did.
And so I want to catch up with you around AI again and go, what's happened in the year since we last spoke?
Well, lots happened, Colin, and it's really been exciting. We've been moving very quickly. The industry's been moving quickly too. So there's a lot of solutions out there that are selling their products to physicians and they're adopting them. But it's really important for us to really look at the opportunity for AI Scribe and define the problem. The problem is, how do we support physicians in the administrative burden that they're facing in terms of the burnout that they're getting from spending all these hours? They're saying up to 19 hours per week per family physician in terms of the amount of time they're taking documenting. So back in October when we last discussed, it was around how do we use these tools to listen using ambient technology of the exchange between a physician and a patient to automatically, through AI technologies, capture that interaction and assemble that information into notes that physicians require. So it's all automated and physicians save a lot of time. They still have to check the output, but it saves so much time. And since that time, we've done a lot of activity with physicians and with various providers of these solutions. So what we did first was had a small group of physicians adopt the technology, test it, and we did a deep dive into what is the true value proposition of these tools, and remove the rhetoric that many vendors have around it saves this, it does that. We wanted to test that for ourselves, and we had incredible results. In fact, many physicians are saying it's bringing the joy back to medicine for them. It's saying that they want to stay in the business longer of helping patients. That it's saving them incredible amounts of time to spend with their family or see more patients, which, as you know, we have a lot of unattached patients. Right. We have a shortage of family physicians that we need that time back. And so this technology is a game changer. It's one of those technologies that actually will help practically in the business of caring for patients. So we're really excited about it. We're in a trial right now. We're just finishing this month of 150 physicians to really validate that first study we did. And then the third phase with us and our partners we hope to do is around scaling. How do we get this technology pervasively adopted by family physicians across the province, making sure it's affordable for physicians, make sure that we have some type of controls and considerations around the data, and making sure the privacy, security, and risks are considered in all of that.
And has OntarioMD's role in all this evolved over the last 12 months? I mean, back then when we last spoke, it was still sort of new, and you were spinning up this program, you were doing the trial. Has your thinking evolved in terms of how OntarioMD is going to get involved?
That's a great question. We were very, at the very start of this, it was a tight relationship between the Ontario Medical Association, OntarioMD, the Ministry of Health, and Ontario Health. And that evolved into making this a priority. And then funding flowed. So it was OntarioMD with a number of partners. Weave, Women's Health, INQ Law, eHealth Center of Excellence, and a number of others have all come together as a group to deliver this project. And it's been really exciting because that group together has been able to really promote the value proposition of this technology.
And the results from this current trial that you're doing, other than the anecdotal, the emotional and the joy that you're talking about, did you realize some of the savings? Did the docs actually get a lot of those savings back in terms of, 19 hours a month or a week that?
So we're still in the final validation. So I can't commit to the numbers yet because that's going to be a published report very shortly.
Okay.
But in the preliminary study, we're seeing between 3 and 4 minutes per visit, which doesn't sound like a lot, but it's a lot when you look at an aggregate across all of the work that the physicians are doing, and up to 90% savings in administrative tasks.
Wow.
So related to patient documentation. So we're very excited about the potential, and that's why we're working so diligently to get this moving as fast as possible, because we want to get it in hands of physicians sooner than later.
So you mentioned some of the steps that you're taking, the 3 steps of where you're going to go with this work, but where in general are you hoping to take AI and OntarioMD? Like where are you seeing that trend heading?
So AI Scribe is just the start. It's kind of like when the internet was invented and we used it for email. And now obviously it's in all of our lives in all ways. And I see AI in the same fashion.
Okay.
So AI Scribe is a practical way of getting started with some AI tools to solve a burning issue that we have and to help physicians. From there, we're already considering abilities to optimize inbox management. So helping with the clinical documentation physicians receive, have to review, remove duplication, make reports shorter and faster, just making the physician clinical and operational workflows smoother. So AI inbox management, AI e-referral, generative AI solutions, AI-driven clinical documentation and decision support. So really working on where is this going. I think the foundation is AI Scribe, but everything's going to move on from there. So it's going to be opportunities for intuitive AI. So you have an interaction with a patient and you talk about a lab test, automatically the lab tests are ordered. Or you talk about a fracture and the image comes up on the screen. Patients are also benefiting. They're getting reports written in more layman's terms,
right,
so they can understand the interaction. They have a record of that interaction. That interaction with the patient is so important because if we're going to really help our healthcare system, we need, it's a team-based sport. So that includes primary care, it includes the hospitals, the specialists, but also the patient. And the patient needs to be enabled and empowered to be part of their care. And that's, I think, one of the big downstream benefits of this is that patients are more engaged. We get more information for patients to educate them and bring them along in the journey of care.
Well, you're certainly starting with the area that docs are most concerned about, right? I mean, yes, it'd be nice to do some generative AI stuff. It'd be nice to have an AI-managed inbox that matches with the inbound documentation maybe to the patient automatically, but those would be nipping at the edges, right? Those are saving, little bits here and there. Mm-hmm. You're going after the heart, which is, I really don't want to do the documentation.
Yes.
And so that Scribe is where most people go to when they at least talk about AI initially.
Yeah, I mean, it's the general supports for physicians and how we can do that. Conferences like here at eHealth, there's incredible amounts of technology. There's great presentations on all this work that people are doing to integrate systems, to create interoperability, to integrate clinical operational workflows amongst the different providers of care. And that's what this conference is about. But many of these initiatives are forward-thinking or independent initiatives that require scaling to demonstrate the value. Right now, we have to do things to support physicians. They are critical elements to our healthcare system, and that's where our priority lies right now. We are not ignoring everything else that's going on, but we need to build that strategy to support practice. So what I call the digital practice optimization plan, and that includes all of the strategies that are going on, but we have to start somewhere and demonstrate the value to the physicians.
Now I want to pivot off AI, although it is a fascinating topic. What are some of the other interesting things that OntarioMD is working on or that you're working on?
Oh, we're working on a lot of supports, a few that I can talk about. We want to support the system in general. So the vision for OntarioMD is to grow, to be sustainable, and to create value and demonstrate value through transformation. So we are supporting, in partnership with Ontario Health and the Ministry of Health, and with our parent, Ontario Medical Association, solutions to really help integrate the system, to create standards for the system, and to create a certification process for the system, not only in Ontario, but across Canada as well. So AI obviously is front and center for us. We have a fantastic project where we're leveraging the collective of the physician group to say, how do we negotiate contracts on behalf of a physician group as a collective for EMRs, for software that physicians use,
Right.
for hardware that physicians use, for costs that physicians incur. How do we represent them through a centralized purchase agreement process? And that has benefit not just for cost savings, but also for creating accountabilities to the vendors for deliverables, on quality, on price controls, on really smoothing the relationship and supporting doctors. We're also working with the ministry on some projects around possibilities around how other layers of care are going to be supported, whether it's home care or long-term care, public health, work we're doing with Canada Health InfoWay to figure out how we can connect national and provincial agendas around sharing information out of physician EMRs. And also working with EMRs themselves. How do we push functionality to improve the experience for physicians? So OntarioMD has a great reach. We're growing. We've got a fantastic vision and trajectory, and I'm really excited about the future holds.
Awesome.
Yeah.
Where can people go to find out more information about OntarioMD, just in case they don't know where to go already?
Absolutely. Thank you, Colin. OntarioMD.ca. Please come to our website. It has all the contact information that you need to reach any of our teams, any of our partners, myself, and I look forward to hearing from people.
And I can't wait to get together with you in another 12 months to talk about how much more progress you've made on AI and all these other fronts, right?
I commit to that.
All right, let's do it.
Thanks, Colin.
Thank you for being on the program.
Thank you.
Hey, I want to thank Rob for coming on camera with me and being so willing to talk about their initiatives at OntarioMD. Really appreciate all the information he shared about their AI initiative, and of course, some of the other things that they're doing in order to consolidate and bring some value to the Canadian healthcare ecosystem. I can't wait to catch up with them next year to see what else they have accomplished. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.